Picture this for a moment. A 62-year-old man recently told he has bladder cancer. We started BCG, hoping it would turn things around, but nothing changed. But here's the part most people never hear about. BCG is a benign bacteria that stimulates the immune system against bladder cancer. It is delivered directly into the bladder through intravesical instillation. But even the standard of care has a dark side. For many patients, like the man in our story, BCG simply doesn't work. Around 30 to 40% fail to respond, and nearly half of initial responders eventually relapse. And when BCG fails, the options become painfully limited. And visit after visit, he kept hearing the same heartbreaking words. Radical cystectomy may be the only option left. But what if the immune system could be pushed further than ever before? Then one day, something different appeared on the table, a new kind of therapy, one that awakens the immune system in a way we've never used before. A treatment that could give him a real chance, a chance to keep his bladder and keep his life intact. That treatment is called Anktiva. So how does this drug actually work? Before we dive into the mechanism, let's understand the scale of the problem. Bladder cancer is most often diagnosed in a form called NMIBC, non-muscle invasive bladder cancer. That means the tumor is limited to the inner lining of the bladder and hasn't yet invaded the muscle layer. And this group represents nearly 80% of all bladder cancer cases. Other form is called MIBC, muscle invasive bladder cancer, where the cancer invades the muscle layer and becomes much more aggressive. This group represents nearly 20% of all bladder cancer cases. The standard treatment is BCG, but 30 to 40% of patients don't respond at all. And even among those who initially do respond, almost half will eventually relapse. In this mechanism, two major immune cells take the lead: natural killer cells and CD8 T cells, also known as cytotoxic T cells. Alongside them, we have our ligand drug, Anktiva. Together, these elements form the core defense against malignant bladder cells. Here's where the science gets exciting. Anktiva functions as an immune stimulant, specifically an interleukin-15 agonist. It binds directly to the interleukin-15 receptor found on both natural killer cells and cytotoxic T cells. Once this receptor is engaged, it triggers a powerful activation signal inside the immune cells, enhancing their function and boosting their ability to recognize and kill malignant bladder cells. In simple terms, it enhances the cytotoxic activity of these cells against the cancer. And this enhanced immune force may completely change the treatment landscape for BCG-unresponsive patients. Now that we understand how Anktiva activates NK cells and CD8 T cells, we can see why this drug is clinically important. But here is an important question. Need to be answered in this video. What is the big value that Anktiva will offer to the bladder patients? It offers a real bladder-sparing therapeutic option for patients who fail BCG. Because it is a more potent immune stimulant than BCG, it enhances cytotoxic activity against malignant bladder cells. And the most important reason, that it acts as alternative to bladder removal surgery. Things that people should know about Anktiva. Anktiva is not a replacement to BCG. It used alongside with BCG. Anktiva has durable response. According to the results of studies, a 33% complete response rate means that 1/3 of the treated patients had their tumors completely disappear. And the most impressive part? For many of these responders, the effect lasted for more than 47 months, almost 4 years of sustained, cancer-free response. And now, let's go back to the man we started with, the patient who was told, again and again, that removing his bladder might be the only option. For someone like him, a therapy like Anktiva isn't just another drug. It's a chance to avoid a life-changing surgery, a chance to keep his bladder, to keep his independence, and to keep living his life the way he knows it. Because with a durable response that can last years, Anktiva doesn't just change the biology of the disease, it changes the patient's story. Thank you for watching. Tell me in the comments, did you know that 30 to 40% of patients do not respond to BCG before watching this video?